now I'll start general inspection. So upon assessing patient, the general condition is satisfactory. Do you know where you are?
Hospital.
What is your age?
40.
Okay, the Glasgow Coma Scale patient is 50. Patient does not look according to her age. She is a bit older than 40. Patient has no fissures, no scars, no deformity on the face. Posture of patient is active. There is no gait. Patient, what is your weight?
40.
What is your height?
155.
Okay. Your BMI is 18.7. Patient seems to have underweight, and upon assessing the skin inspection, patient do not have any scars, hyperpigmentation, dyspigmentation. Can you please turn around? The back is normal as well. Please turn back. Okay. Now I'll assess the subcutaneous fat. Can you please turn around? Okay, turn back. Subcutaneous tissue is normal. It is 2 centimeters square. Now for lymphatic system, upon inspection, there is no enlargement of any lymph nodes. Can you please relax your arm? Upon assessing the lymph nodes do not seem to be enlarged. However, lymph nodes of the left infraclavicular and left axillary seem to be a little bit enlarged. Now for muscular system, upon inspection, patient do not seem to have any muscular atrophy. Muscle is well developed. Now upon palpation, patient, do you feel pain?
No.
Okay. Patient do not feel pain. Which one is your working hand? Okay. Now squeeze my finger. Okay. Now put your hand up. Resist. Okay. Patient muscular strength and tension is normal. Now for bones, patient, can you please raise up your hand? There does not seem to be any bone deformity. Bones is equal on both sides and are symmetrical. Upon palpation, patient, do you feel pain?
No.
Both patient does not feel pain. The bones does not seem to have any issue or deformity. Joints, upon inspection, does not seem inflamed. There is no hyperemia of joints. There is no swelling. The joint's temperature is normal. Does not seem to have any subcutaneous emphysema. So the joints are not deformed and they are not compromised. Next, the vertebral column. Patient, can you please turn behind? Upon inspection, patient posture is straight. The vertebral column is in the normal position. There is no kyphoscoliosis or scoliosis. Okay, can you please turn back? Upon palpation and percussion, the vertebral column is straight and in the normal position. Now on the head, patient eyes do not have any endophthalmos or exophthalmos. It is normal. Patient's nose does not participate in breathing. The nasal wings are normal. The lips and mucous membrane of the mouth is pinkish and are normal and they are not dry. Now for the head, upon inspection, patient eyes do not have any bulging. There is no exophthalmos or endophthalmos. Patient nasal wing does not participate in breathing. Patient's lips and mucous membrane is pinkish and normal. There is no visible fissures on the face and there is no deformities of the face. The face is normal. And upon inspection of the head, there is no palpable deformities of the head. The head is normal. And upon inspection of the neck is cylindrical, and the thyroid gland is not palpable. And do you measure your temperature in the morning?
No.
Okay. So now I'll measure your temperature. Okay, patient's temperature is 36.8. So I'll be talking about the conclusion for general inspection of breast cancer. So patient has is presented with a lump on the left breast. So after general inspection, I can say it is unlikely to be infection because there is no fever and there is no increase of temperature. There is a regional enlargement of the left axillary and infraclavicular lymph nodes, and this suspects that it is likely to be a malignant tumor because it is no fever, it is not infection. As for the laboratory and instrumental examination that would likely be ordered, first is the level of inflammatory proteins to assess the signs of inflammation and also to assess the function of the liver. So we will also need to order a total blood count, which is a normal screening test, as well as biochemical analysis for the liver function, such proteins as ALT, AST, as well as others, to determine whether the liver function is normal. Because likely, if it is a malignant tumor, what can happen to the liver is malignancy will cause metastasis. And metastasis will usually go into the liver or the lungs. And hence, for instrumental examination, we will order plain chest X-ray to determine for metastasis. And we will also ask the patient to do a mammogram. And for secondary choice for instrumental diagnosis is MRI scan. And moreover, we can also ask to do an aspiration of biopsy of the breast lumps, and this is done to grade for the TNM classification. However, this is done in the local status and it should be emphasized